right, let's dive right into chronic pain, okay? And let's talk about why it's such an epidemic and what can be done about it and just all the ins and outs. Now, it's a huge topic, so this is just one video, one layer, but hopefully this unlocks a few ideas to help you, okay? So one of the biggest things that we're going to talk about right now is the conventional medical answer to chronic pain and why it's, there's a place for it, but why it really ultimately fails to really help relieve the true underlying causes, the root cause, and help you lead a better life, okay? Hi, I'm Dr. Jason McCammon, board-certified naturopathic doctor. I have training in many functional areas of medicine, including physical medicine. And by the way, I'm a chronic pain survivor myself, so I've literally lived this for many years, so I know what you're going through. It's difficult. So let's get into what's broken, first of all, about the chronic pain system and some of the things that it can cause. First of all, depression is big. Whenever you have pain in the body, you get what's called nociception. These are when the nerves send signals to our brain that we're not okay, and that really messes with our brain centers that help us with mood and it tells us everything's okay. When you have pain, our brain tells us we're not okay. So it really is a big contributing factor to depression, weight gain as well. And why? Well, because you're not as active in doing things, you're more cautious to do things, you don't move as much, or maybe more weight gain there. And also when you're depressed, you might eat maybe more comfort foods, right? Loss of sleep is big. Without sleep is such a huge tenet, guys. You got to be able to sleep really good to really have good health. And if you're tossing and turning, or if you have just so much pain, you just can't even get comfortable at night, it's gonna be hard to be healthy when you have loss of sleep there. Reduced wages, people don't realize this, but it can cost you a lot over the long term with your career because, again, not being able to focus as much because of your pain, medical appointments, maybe things that drugs or other lifestyle factors with managing the pain that cause you to not be able to maybe put the type of quality into your work that you'd like to, maybe not as with being able to show up with this amazing attitude can reduce your risk or your rate of which you might get a promotion. So it can really affect wages there, not to mention time off work. Now our conventional medical system does really good. It's got amazing training when it comes to acute pain. If you just tweaked an ankle or a knee, maybe a son or daughter, spouse, in a car accident or something like that. It's really incredible when with the amount of medicine and techniques and the emergency department physicians. I've had clients that are in the ER department. They're incredible skill set, and they're really good at taking care of that up front with the drugs and the procedures, all the surgeries with the hardware they put in. Some of the stuff is really amazing. The problem is with the chronic pain, and that's what most people deal with, not acute pain. That's where they don't have as much training, in my opinion, and I've seen a lot of times some poor outcomes there. So I definitely want to show you the contrast there. So there's what medicine also often refers to treatment. Okay, they keep saying that word treatment. When we look at treatment, what does that really mean? It really means you have a achy knee, and we're going to treat the knee. Does that make sense? We're going to treat it. So if we just look at the knee as an isolated joint, there's only so much we can do, okay? If it truly has a pathology such as a torn meniscus or an ACL, yes, you probably should get that looked at, and if it requires surgery, so be it. But often, I don't know if you know this, but the knee joint is simply what I call the canary in the mine, okay? It really excuse me, it really reacts to what's going on at the ankle, foot, and then at the hip level. And if you're not addressing those things at the ankle or the hip, then the knee is going to suffer. Okay, it's more of a reactionary joint. It's also what's called a joint of it needs a lot of stability, where the ankle and hip typically need what's called mobility. We'll get to that in a little bit, but there's one example for you where you can't just stare at the knee joint and say, hey, this thing hurts, fix me, doc. There's more to it than that. Okay, especially when it comes to chronic pain. We've got nociception. We talked about a little bit earlier, that it sends those pain signals back to the brain that something is wrong. What it does, the longer you're in pain, the more those signals from the brain, again, in this case down to the knee, it constantly sends those, and the more likely it is to keep sending them, the more you have that pain nagging you, okay? Inflammation is big as well. We think of inflammation as like, man, I hate inflammation because it causes pain. Well, actually, inflammation is a good thing. It's our body saying something is wrong. We need to attend to it. So at first it's helpful, but long-term inflammation, really wears us down. It can cause atrophy of the muscles and cause a lot of problems long-term.